of the pillars of sexual health is understanding how it connects to overall health. So, and I learned this in treating men. So, you know, when the advent of Viagra came out in 97, there was this huge push by doctors to now all of a sudden say, hey, actually, when men, people with penises start experiencing erectile dysfunction, this is actually potentially a cardiac issue. So now
Right.
we were equating your sexual health with your heart health, which when now people are like, oh, it's your heart. We care so much, right? And so they were literally able to get your sexual health and your heart health combined together. Like it's actually in our clinical guidelines for urologists that if someone comes in with a new erectile dysfunction, we have them do a cardiac workup. Like it is so ingrained.
Wow.
That's what I was trained with. And then when I did my fellowship, and you know, one of the only fellowships in the country that actually specializes in women's sexual health, which if we again think about it, sexual health is a marker of overall health. Only one program in the country. There's another one, Dr. Sarah Signa at GW through gynecology. So we're really excited about that. But that's just two now.
Right.
so,
Right.
and so it's a really interesting thing of like in men, we consider people with penises sexual health as, oh, that's health. And of course it's health. But in women, you know, when we know with menopause, with the lack of hormones, like in the decrease in hormones, that's where we're going to get a lot of sexual dysfunction. And yet we don't have that same reverence for, oh, a person coming in with low libido. Let's elevate this as not just like this frivolous thing of, oh, she's not having sex, it's not that big of a deal, or they're not having sex, not that big of a deal. Let's elevate it to like they're not having sex, they're unhappy about it. And this is also potentially a marker of a bigger medical problem, right? And I think these I think it's just really adding to the validity of it, right? Like sex is oftentimes dismissed as this like poo-pooed and whatever. Just in women's health, we very take it very seriously in men's health, and so I don't I want to bring the same
Yes.
level of like acuity, evidence-based research, knowledge, treatment plans, and just like validation to
Yeah. Yeah.
people of like, you know, your sexual health isn't a secondary part of you, it's your primary part. It is a primary part of your life. And so many women I will see, and I'll talk to them about their vaginal health, and they're like, well, I'm not having sex, so it shouldn't matter. And I was like, okay, well, let me give you this analogy of, okay, what if I were to tell you that your foot, if you didn't put a low dose vaginal hormones on your foot or like a lotion on your foot, it would become red raw, inflamed, chronically infected, shriveled up, painful always. And they're like, well, I would obviously put lotion on. I was like, well, you're not a marathon runner, but you still want your foot to be healthy. You're not having sex, but your vagina and your vulva, they're changing and they're having these same changes. So you should prioritize that just the same as you would prioritize any part of your body. Because it's sex, it's always dismissed. It's always as a tertiary or a secondary or tertiary thing. And I want people with vulvas, women, to start thinking about their sexual health, not just as this like additional thing, this frivolous thing, is but like, no, this is central and vital to my overall health.